Okay. Bismillah. My name
Nanti
is
dulu, weh, tak suruh present dulu. Siapa yang present dulu? Siapa angkat tangan dulu? Siapa present?
For the first case, me,
Siapa
Noh
yang
Hadini.
Nur Hadini. Case apa? Introduce your case.
Case Eba.
Is that how you introduce your case?
No, sorry, Doctor. Muhammad Rizwan, 11-year-old Malay boy with underlying bronchial asthma, presented with shortness of breath for 1 day duration.
Okay, siapa next? Siapa presenter?
Me, Najira.
Najira, introduce your case.
Shakina, 1 year 1 month, Malay girl, presented to HTAA due to rapid breathing for 2 days duration.
Nuha, present dulu.
Okay, Bismillah. I will repeat the chief complaint. Muhammad Rizwan, 11-year-old Malay boy with underlying bronchial asthma, presented to emergency department of Susmed with shortness of breath for 1 day. So the patient was well until 2 days prior to admission, where he developed cough for 2 days. The cough, it was productive cough with whitish sputum. There is no blood content, and it was associated with runny nose of clear discharge, sore throat, and also sneezing. So on the next day, the cough worsened, especially at night. He also started to have shortness of breath at night. It was the shortness of breath occurred suddenly. It caused disturbance in his sleep, so he took MDI salbutamol for 2 times. The symptom resolved, and he was able to sleep. So on the next day, which is on the day of admission, he developed recurrent shortness of breath. It was associated with chest tightness and noisy breathing. He took another MDI salbutamol, but the symptom did not resolve. So he was brought by his father to emergency department. So at ED, he appeared conscious, alert, and able to talk and phrase. The breathlessness only occur when he talk. There is presence of chest indrawing, and the temperature recorded is 37 degrees Celsius. He was also able to tolerate orally. So on further questioning, he did not complain of fever, chills or ichor, pleuritic chest pain. There is also no similar symptoms run in the family. No hemoptysis or contact with TB patient. There is also no orthopnea, paroxysmal nocturnal dyspnea, reduced effort tolerance, and no known heart problems. He also did not complain of palpitation, easily fatigued, or dizziness. So, patient was diagnosed with bronchial asthma since 4 years ago, which is at 8 years old. Currently, he was on MDI salbutamol PRN and MDI fluticasone bidaily. He claims to sometimes miss the fluticasone medication. He was not on any follow-up. For the asthma control, he experienced daytime chronic cough and shortness of breath more than 2 times per week. He also experienced night waking due to asthma symptoms. He needs a reliever more than 2 times per week, and he also have activity limitation due to asthma. The patient did not have symptoms suggestive of eczema. He have allergic rhinitis but not on treatment. Otherwise, there is no family history of atopy. So at home, he have carpet and it was claimed to be dusty. He also have cat and frequently always play with the cat. His father is a smoker, and occasionally there is open burning during evening near the house. And however, the house is far from the main road and any industrial area. For the system.
Tapi dah HOPI.
Yes. Next systemic review.
Systemic review apa yang nak beritahu?
No, generally it was unremarkable. Patient did not complain of loss of appetite, rashes, cyanosis. Patient also did not complain of any GI symptoms such as nausea, vomiting, diarrhea, constipation, no changes in bowel habit. There is also no hematuria, dysuria, frequency or urgency.
Okay, habis. Sarah, any question?
I want to ask if did the patient have fever?
Patient did not have fever.
Aisyah?
Does the patient have post-tussive vomiting?
No.
Najira?
Any history of going to crowded area or exposure to COVID patient?
No. Okay.
Fadila?
How many times does he have exacerbation in 1 year?
In 1 year. For this year, this is the first exacerbation requiring hospital admission.
So how many times?
One time.
The first time.
First time for this year.
No admission before. Arif, any question?
Okay.
So does the cough intermittent or persistent?
The cough is persistent throughout the day for 2 days. However, it's especially worsened at night.
Fazira?
Just now, the presenter mentioned that the child had shortness of breath when talk. Did she can speak in sentence or phrases?
He can speak in phrases.
Masha Fizul?
Okay, I want to ask about the asthma severity, which is there any exercise-induced symptom? And about the nocturnal symptom, how many times per week?
So he has exercise-induced symptoms. So the patient avoid to do exercise. About the nocturnal symptoms, I forgot to ask how many times for the past 1 week.
Aimi?
I would like to ask, what is the reason that he defaulted follow-up?
So because of the parents have no times to bring the child. This is said by the patient.
Nurul?
I want to ask, other than the triggering factor that you have mentioned above, so is there any exacerbation due to the cold temperature or even food?
So the identifiable precipitating factor is cold temperature and URTI. The patient did not complain any allergic to food.
Any other questions?
Sorry, just now did the presenter mention about the contact with sick people?
Oh yeah, I forgot to mention. But he did not have any contact with any sick contact.
About the noisy breathing you mentioned, is it wheezing or stridor ke? But parents dia cakap macam ni, describe how the sound.
I think it is wheezing. Wheezing. Because this is not the first presentation, so patient pun kata bunyi dia macam macam musical macam tu.
Any other questions?
May I know about the school performance of this child in terms of attendance?
Generally, it was average performance in academic. For the attendance, I did not ask.
Any other question?
One more question. When was he diagnosed with asthma?
He's 4 years
8
old.
years old.
8 years old, huh?
8 years old.
Lagi ya?
What are the presentation during that time?
The presentation at that time was quite similar to the current presentation. So I think it was due to URTI. Patient was admitted and then he was discharged with MDI salbutamol, PRN.
Symptoms started what age?
Sorry, doctor?
Symptoms started at what age?
8 years old.
Sebelum tu tak ada symptoms? Asymptomatic before that?
I didn't clarify.
Huh?
Briefly.
Pardon?
I didn't clarify thoroughly.
You didn't clarify thoroughly. Siapa presenter next one?
Nazira.
Nazira, mana dia? Tukar tu. Najira ke Nazira?
Najira.
Najira, present.
Okay. Shakina, 1 year 1 month, Malaysia, admitted to emergency department of HDE due to rapid breathing for 2 days duration. She was apparently well until 1 day prior to admission, around 11 a.m. when she developed rapid breathing while playing at home. The patient initially went to Klinik Kesihatan 1 Malaysia at Kempadan and was nebulized and discharged with syrup paracetamol. She also had multiple episodes of going to GP with the same shift complaint and was nebulized and was discharged. A few hours prior to the admission, which was around 10 p.m., her mother noticed that she had developed rapid breathing again and took her straight to the EDHDA. According to her mother, her daughter uses her mouth to breathe, and the rapid breathing attack was sudden in onset, which is not worsening and associated with noisy breathing. It was not relieved by rest, and at the ED, patient was pink, conscious, good hydration status. However, she is tachypneic, and she was nebulized for 2 times and was put on nasal prong oxygen 2 liters per minute. It was also associated with chesty cough, where the cough is sudden in onset and occurred for about 3 days prior to admission. It was described as productive in nature with yellowish sputum and scaled to be 1 full tablespoon. However, the cough was not whooping or barking in nature. She also experienced post-tussive vomiting for about 3 times on the day of admission. It was also associated with runny nose with clear nasal discharge. The patient also had fever for 2 days prior to admission. According to her mother, it was warm to touch and the documented temperature was 37.9 degrees Celsius. The patient was not given any antipyretic. And then on the day of admission, she had a loose stool for 2 times, and the stool was brownish with Bristol stool scale of type 6, and there was no blood stain or no overflowing from the pampers. And then the patient also had history of contact with her 3-year-old older brother who had upper respiratory tract infection with no fever. Otherwise, the patient was active at home and able to sleep well at night. There are also no history of rash, eye redness, discharge, asthma, hemoptysis, cyanosis, leg edema, abdominal swelling, vomiting, trauma, fitting, and ear discharge. There was also no history of taking outside food, traveling, or going to crowded area. No daytime, nighttime, or exercise-induced symptoms. Generally, the patient appetite was disturbed since for 2 days prior to admission. However, there is no disturbance of sleep and no rash. Other systemic review are unremarkable.
Any questions?
I want to ask about his oral intake during the sickness. Is there any changes?
Yes, the oral intake is reduced.
Any questions?
Any chest recession noted?
During the admission, there is small chest recession.
Was the patient still active?
He is reduced in activity, being inactive.
Ada chest recession tadi? Ada chest
Ada
recession?
mild chest recession.
Is there any aggravating factor for the rapid breathing?
There was no aggravating factor for this child.
You mentioned that she developed rapid breathing while playing. I mean, what is she playing at that time? Running or something else?
Oh, sorry. I have no answer for that question. I need to further clarify.
Is this the first episode of rapid breathing or this child?
First episode.
Does the child have difficulty in sleep?
No.
Does she have any atopy?
No.
How about family history of atopy?
There is no family history of atopy or allergic rhinitis or eczema run in the family.
Family history of asthma?
No.
Does the patient has any underlying disease?
No. However, he had episode of febrile fit previously.
At what age?
9 months.
Any exposed to contact with TB patient?
No.
Any exposure to birds, burung ke apa?
Sorry, I do not have the answer for that.
Does her brother have medications for the URTI?
Nurul.
Sorry, I'm not sure about that.
Nurul Atirah.
Yes.
This patient present can ED. The first patient and second patient. In your opinion, which one is more severe?
I think the second one,
Why you say the second one?
because from the what my friend has shared, that she had been go to GP multiple times, but it did not resolve. And then she also has fever.
That's all.
Yes.
You mean
Yes.
that patient cannot die because of asthma?
Pardon?
You mean patient cannot die because of asthma?
Yes, patient can die.
So why you say the second one is more severe?
Because of the persistent in the rapid breathing. Because of the persistent in the rapid breathing.
How bad is it, the rapid breathing? The first case pun tak ada rapid breathing.
Yes.
Tak ada rapid breathing the first case.
She has shortness of breath.
Dah tu. Both got shortness of breath.
Yes.
This one persistently 2 hari dia okey, yang ni acute terus masuk ward. So you still think
I think the first case is more severe due to the acute in presentation, more acute. And then he also has underlying of the bronchial asthma.
You mean that the child who have bronchiolitis, who have broncho pneumonia, they cannot die? Only asthma can die.
They can die if the infection is severe.
How you know it's severe?
From clinically, if the patient is come with the severe in the
How you define severe?
Because when the patient is presented with the alteration in the mental status or having evidence of the poor rapid breathing.
Which one got which one?
The first one has evidence of the indrawing of the chest, and then but he is still conscious and also able to talk in phrase and also able to walk.
So both got session.
Setiap kali memasuki premis hospital termasuklah klinik, ward, makmal dan pejabat pentadbiran walaupun untuk urusan seketika. Dalam masa yang sama, anda dinasihatkan untuk mematuhi prosedur operasi standar SOP yang telah ditetapkan seperti memakai penutup muka, memakai kelengkapan perlindungan diri PPE yang sewajarnya, mematuhi penjarakan fizikal, kerap mencuci tangan, mengamalkan etika batuk dan bersin, serta elakkan dari berkumpul. Mencegah penularan COVID-19 adalah tanggungjawab kita bersama. Kita jaga kita. Sekian, terima kasih.
Amy, what do you think, Amy?
I think the second case is a more
Why you think
severe
second one more severe?
because the pneumonia can lead to sepsis.
Do the child got evidence of sepsis?
No, but he has severity in pneumonia, such as he has tachypnea and not able to drink because it was stated that the appetite was disturbed once she developed rapid breathing.
The appetite is
Disturbed.
Disturbed. That's all disturbed. What do you mean by disturbed? So you can drink the 3 ounce to 2 ounce, it's okay. 3 ounce to 1 ounce, perhaps significant. Disturbed can be anything. You mean the child with asthma? How bad with the child with asthma? This one. How bad do you think the child with asthma? Mild, moderate, or severe?
Moderate.
Why you say moderate?
Because the patient is having shortness of breath when talking. He can still talk in phrase, and he is alert. The respiratory rate is increased, and there is also evidence of accessory muscle use, as told by the parent, and there is also presence of wheezing, and yes.
The second one, second patient? Mild, moderate, or severe?
Severe.
Why is it severe?
Because there is also presence of chest indrawing.
Itu kata, Najira, ada recession.
Ada mild recession.
Mild recession. Is it enough to have mild recession? You can already decide it's moderate or it's severe.
No.
Why you say severe? The child only got mild recession.
It's mild pneumonia.
Huh?
So it is mild.
So which one
pneumonia.
more severe? First case or second case?
Doctor, can I try? I think it's the second case.
Nanti dah dulu, Amy dulu dia ni.
Second case.
Second case, I got mild recession only. The first case, obvious recession.
Not sure. Okay. So first case.
Tukar pula. Mahafizul.
I think the second case.
Why second case? Your colleague can argue, still want to argue. Why?
Because she have much younger age.
Okay, younger age lagi. But then is the age can define your severity. The age only define you the risk factor only. They are even, let's say they 11 years old, sinus, and then they're 2 years old, not sinus. Which are more severe?
Sorry. The
This
sinus.
11 years old child who will be distressed with sinus. This 2 years old with be distressed, not sinus. Which are more severe? The 11 years old or 2 years old?
The older one.
Then so the is it age indicate age should tell you that it's more severe? Cannot analyze history. No, Fazira.
I think second case because the patient already have multiple nap but still unresolved, and also the patient also have loose stool and also I think so risk of dehydration.
Why the child got loose stool?
Maybe a typical
How severe
presentation.
is it, the loose stool is? Is it so severe that you need to put is patient severe?
Patient has loose stool and also the patient also has a reduced feeding.
The other patient got disturbed feeding when refuse feeding. Does patient disturbed feeding ke refuse feeding?
Reduce.
Huh?
Reduce feeding.
The patient got refuse feeding ke disturbed feeding?
Reduce.
Reduce. I mentioned reduce.
Yeah, your patient reduce. So even Fadilah patient pun can reduce feeding. So how bad is the diarrhea? You mentioned about diarrhea. You think how bad the patient is having diarrhea?
I'm not sure how many times the patient has the.
Then why you say that you think the diarrhea is an indicator of severity when you don't know how bad the diarrhea is?
Because patient had diarrhea and also vomiting, and at the same time patient also had reduced feeding, so patient might have a risk of developing dehydration.
Yeah, patient got risk dehydration, but that's not important. The important is what to risk. We don't talking about theory anymore. We're talking about patient. Your colleague dah present. I let you ask question already. Now you mentioned to me about diarrhea. Then I want to ask you how bad the diarrhea is.
I'm not sure.
You think the patient with diarrhea vomiting ni banyak masuk ward ke banyak di rumah? You all kan pernah ke diarrhea vomiting kan? You semua setiap kali masuk diarrhea vomiting you masuk ward. Nordini, how you assess severity of diarrhea? So can decide diarrhea is significant or not significant?
Based on assessment of hydration.
What you think about this child hydration?
It's not mentioned. Wait. Patient have.
What thing you want to know in the history that you thought important to tell you how bad is the hydration of the child?
The mental status. Does the child appear more irritable? And high pitch crying. And then irritable.
Ada apa lagi?
And then urine output. It will reduce.
So this child got urine output reduce, not reduce?
I think it's not mentioned.
Then why you all didn't ask? Anything else?
The skin, does it appear more dry mucous membrane, sunken eyes?
Is there any mention mother noticed that or not?
Did not mention.
So how you think? So you think it's about to? So how you think about hydration status? Can it tell you that how bad the diarrhea is the child is? In this case,
no, we should ask more.
So can it indicate how severe the child is? How bad the child is? What the chief complaint in this case?
Second case, rapid breathing.
So Arif,
Yes,
which one more severe? The first case or second case? We are talking about chief complaint of this case. The chief complaint is rapid breathing.
I think the the first case.
Why you think the first case more severe?
Because the presentation with shortness of breath.
The first case got shortness of breath.
The first case.
The second case got shortness of breath also.
The second case have rapid breathing. With
Same thing got rapid breathing. The first case got rapid breathing.
Because of the first case presented with moderate severity of asthma, and
the second case, how bad is it? Mild, moderate, or severe?
The second case like mild.
Why you say mild?
Because he's not breathless. He is alert. The wheezing is there is a wheezing, and then there is no usage of accessory muscle.
The second case ada mild recession. Najira, you agree your patient is alert?
Yes, the patient is alert.
Lagi, you agree with your patient is the other one, right? Apa you mention dia Arif? Alert lagi?
No use of accessory muscle.
You agree with patient no you use accessory muscle?
There is usage of accessory muscle, but there is mild recession.
Apa lagi you mention? Tweeting you mentioned just now.
Tweeting.
Dua je.
Because we cannot assess
the
whether
patient is wheezing. You agree with that?
Wheezing.
Yes, the patient has noisy breathing.
Noisy breathing. But is it wheeze or not?
Wheezing.
Wheezing, not stridor.
No stridor.
How you know it's not stridor? The case without written it was wheezing or noisy breathing.
Yes. It mentioned that the patient had noisy breathing with rhonchi.
Rhonchi, you know what rhonchi is?
On auscultation.
Auscultation. Wheezing when you have heard. So you agree with that the case without though?
Not really.
You mean the first case tak ada wheezing?
Sorry?
The first case no wheezing.
The first case had wheezing.
The first case also have wheezing. Go ahead. The first case also have wheezing. The first case also not so tired. The first case also have accessory muscle usage. Fadila?
I think the first case is more severe because the patient came with shortness of breath and had he was given salbutamol, injected salbutamol, but it doesn't resolve. And then because he also talk in phrases, and there is wheezing and also use of accessory muscle.
Is that what your this patient also, this second patient also use accessory muscle? The second patient also wheezing. Even the second patient also have reduced all the intake some more. We cannot expect the second patient cannot talk with phrases. He cannot talk just age of 2 or 1 year plus.
Because the second patient, it said that the child is still active.
Your patient not active. Weak lethargy. Huh?
No.
Your patient is what?
He can talk in phrase, can walk.
Can walk. Lethargy? No. Active still.
Not mention about the lethargy.
What is saturation at ED?
Doesn't mention.
No. Your patient Najira, what is saturation at ED?
At ED, not mentioned. However, in ward, 98%.
You got no point already lah. Most time treatment was given. Your patient need oxygen or not?
Not mentioned.
Yeah, Fadila, your patient?
Oh, no oxygen, no oxygen. At ED.
ED need oxygen. Your patient, Fadila?
First patient, doctor.
Yeah, first patient.
Oxygen.
Is the first patient need oxygen or not? On admission, on ED.
Yes, on oxygen.
Nah, so dua-dua sama je. So no Aisyah, Aisyah, what you think?
I think the severity is the same.
So you become natural to be a safe side. You decided it's the same. You're unable to decide which are more severe. But if in your case, which one you more worried? The first case or second case? So I didn't ask severe anymore. I ask which one you more worried?
The second case, because the patient is a younger age, prone to dehydration compared to the first case. And then patient have fever suggestive of infection, so patient may end up with sepsis. And then
or the activity level of the patient. For the first case, patient still active. The second case, patient already reduced level activity.
Betul ke Najah? Reduce level activity.
Inactive.
Huh?
The patient being inactive.
Inactive. Sarah, what the essence of the first case?
So for first case, Rizwan, 11 years old Malay boy with underlying bronchial asthma, presented to emergency department due to shortness of breath for 1 day.
Apa susah sangat. Noisyah.
Doktor.
Aisyah. No, Aisyah.
Yeah, so the second case, Doctor.
The first case.
First case, so patient come with shortness of breath for 2 days.
Najira.
For first case, 11-year-old Malay boy with underlying bronchial asthma presented to ED of suspect with moderate severity of shortness of breath for 1 day duration.
Fadila.
Years old Malay boy with underlying bronchial asthma presented with shortness of breath for 1 day.
Arif.
So 11-year-old Malay boy with underlying bronchial asthma presented to a suspect with moderate acute exacerbation of asthma for 1 day duration.
This asthmatic child who having acute exacerbation. What the next thing come to your mind? Arif.
The acute management of this patient.
Why you want to go acute management? You don't go to management yet.
Investigation.
Nuha, this is a asthmatic child who having acute exacerbation. What the next thing come to your mind?
Look for any complication.
Complication. Why we look for complication? Patutlah you tak solve problem. Nafazira.
About the severity.
We do discuss severity kan? Kita dah habis discussion dah.
For the admission or not to treat.
Mas Hafizul.
The triggering factor.
What we call that?
Sorry?
What we call that?
Factor.
Yeah, triggering factor. What we call that?
The accessibility.
We want to see the causes. What the causes of acute
exacerbation?
Exacerbation. This child is acute exacerbation. So, what possible cause of acute exacerbation? From where to what is possible cause acute exacerbation?
Infection such as URTI.
Lagi?
Sorry?
Lagi apa?
Dust.
Dust. Dust lagi.
Cold temperature.
Okay, there is triggering factor. Ada triggering factor?
Smoke.
There's all triggering factor lah. All the triggering factor. Other than triggering factor, apa lagi yang can cause acute exacerbation?
Non-compliance to medication.
Non-compliance. Bagus. Budak lelaki memang bagus fikiran dia. Lagi? Apa lagi? Non-compliant. Lagi apa lagi? Benda ni common sense je. Lagi apa?
Miss. Mismedication.
Okay, we're talking non-compliant. You already talk non-compliant. Apa lagi?
Inadequate medication.
Inadequate medication lagi. Wrong medication. Technique not proper. So is the history answer all those questions?
No. Tak clear.
Tahu pun tak clear history. Then history answer can tell you why the child is having acute submission. Why? Because you want to treat the patient, but you don't want him to have another acute submission a few months later. So what do you think about the cost? The child got what's the trigger of this case? You already decide the child is moderate, it's a submission. You already decide on that. Now you want to know what the triggers, what cause the child having acute exacerbation. For moderate exacerbation, you already decide what to treat. But is it enough? Now you want to know what the cause. Siapa present tadi? Kes ni. Kenapa you bertukar tempat dia? Bila the treatment start budak ni ada problem?
At 8 years old.
How do you diagnose asthma?
He was admitted due to, I think, URTI.
How diagnose asthma?
Using post bronchodilator PFR.
Who diagnose asthma? How they diagnose asthma?
Diagnosed by the doctor at HAA.
Okay, how they diagnose? Because of admission to the ward. After admission, before that, no symptom.
I didn't ask.
You think that first admission already diagnosed asthma? Do we diagnose asthma as first attack?
On the first.
Do we diagnose asthma on the first episode?
No. Yes, we can if the history is suggestive.
Still suggestive. We don't suggestive. We have to diagnose asthma or not asthma. We don't need history suggestive, not suggestive. We clock the history. We think asthma or not asthmatic. That's all. But do we diagnose asthma on the first admission, first attack? What is asthmatic definition?
Chronic reversible airway inflammation.
Itu is underlying dia punya tu pathological, the symptom, the clinical definition. Tisnya lah
recurrent episode.
Recurrent episode of shortness of breath, coughing. Letih mengajar you all ni. Then after that, yes. What happened after that? Diagnosed asthma.
Discharge with MDR salbutamol.
Start with salbutamol only. Then after that?
for follow-up, but then he defaulted.
Then
And patient also have another admission, also due to moderate
when was that?
exacerbation, 1 year ago,
1 year ago. Age berapa?
10 years old.
10 years old. One more admission. After that, what happened?
Added on fluticasone BD.
You started on fluticasone. Then after that, follow up in the clinic.
Follow up, but he did not go to follow up.
Didn't come to follow up, so poor compliance.
Yes.
Techniques are unknown.
Techniques we assess and it's
During
okay.
that then after that, what happened at the age of 10 years to 11 years?
No exacerbation, but patient have daytime for the
Did the patient
past 1 month.
went to anywhere or not for nebulizer ke apa ke? At 10 years to
No.
11 years.
No, only use his own medication.
What medication?
Fluticasone and salbutamol, MDI.
Salbutamol. But did the compliant, how you know you using properly or not? Because did it come for follow up? Then what happened at the age of, for this admission, what happened?
Patient I just like to say, patient also frequently miss the fluticasone.
Okay, doesn't matter. Until the age, until the age, for this admission, what happened?
Patient develop symptoms of URTI.
Then
started to develop shortness of breath.
Lagi?
Chest tightness and also wheezing.
Wheezing. A day before admission.
Yes.
They then use the medication.
He used medication for one times. It resolved, but
not respond.
Yes.
Then dia pakai chamber tak?
Aero chamber.
Then after that, he went to the
emergency
department. Noted that the child can walk, not sinus. Talk in phrases.
Yes.
But the subcostal to costal recession.
Yes.
Wheezing.
And wheezing.
Saturation during that time? Tak tahu.
No, tak tahu.
Tak tahu. The child was given nebulizer there and oxygen.
Yes.
Then admitted.
And admitted.
So
also oral prednisolone.
So this is a third admission.
Yes.
The child got exercise induced or not?
Yes.
Known to have exercise induced symptom. Child can have coughing daytime and nighttime. How many times they use the MDI per week?
More than 2 times.
More than 2 times per week. The child got allergic rhinitis, eczema.
The child have allergic rhinitis, but no eczema.
Father smoker.
Yes.
Stay in the house environment.
Quite poor. Where they have carpet and then.
Carpet.
Pets.
Environment
outside
near to the factory. Father who are asthmatic in family?
No, the father and the mother did not have asthma.
Sibling?
Sibling, no.
School activity? Can dia belajar, miss school? Letih, tak satu persatu nak keluar. Apa lambat Nuha? Orang lain cepat je, tak. You nak keluar satu persatu tu payah.
The school performance, I did not ask.
Aimi. Aimi Solihah. Tak nampak muka. The second case, what the SM second case. Hilang terus. Amy, what the SM second case?
Sorry, doctor, my internet. Okay. The essence for second case is 1 year, 1 month Malay girl having pneumonia.
Kita tak diagnose lagi pneumonia. It can be bronchiolitis. It can be foreign body. How you want to know? Do we diagnose pneumonia? Kita tak pergi physical examination pun tak pergi lagi. How you diagnose case without physical examination? Atilah.
Patient Shakina, 1 year, 1 month old Malay girl, presented with history of rapid breathing for 2 days duration.
So what the SM the case?
Patient presented with
presented. Tak boleh ke guna ayat yang tu sikit? Flare tu ada sikit.
lung infection.
Mahafizul lah.
In compare to first case, the second one does not have underlying asthma.
Okay, so how you summarize? How you give one sentence about this case?
Okay, Shakina, 1 year, 1 month Malay girl with no underlying disease.
Fadzil.
1 year old, 1 year, 1 month old girl.
1 year old girl who are having apa?
Having a rapid breathing.
Shortness of breath for
2 days duration.
Tak payah tambah. Masa you all ni perempuan suruh tambah. Tak pernah habis. Short and concise je. The act you kena tambah pun is fever with persistent with fever for 1 day, 2 days. Tu je. Orang perempuan ni dia tak boleh short. Dia mesti nak tambah. So there is a 1 year boy, baby, 1 year old child having shortness of breath for 2 days, or fever for fever for 2 days. For what next thing come to your mind, Fazira?
To know the underlying cause.
The cause of shortness of breath on this 1 year old. So before you want to know about the causes of shortness of breath, what you need to have, what the knowledge you have to know, you have to have.
For the finding on physical examination.
Nuha?
Based on this clinical assessment, history and physical examination.
Apa yang you baca dalam buku?
It can be due to pneumonia.
Arif?
Yes.
This is a 1 year old boy, 1 year old child who having shortness of breath for 2 days. What the knowledge you have to have inside your brain to solve this problem cases, this case problem?
You have to know the differential diagnosis, such as lower respiratory.
You have to know all the causes of
shortness
of breath for this
patient.
Now, shortness of breath for the children for this age.
Yeah.
Where you would want to know all the causes of shortness of breath?
According to the age.
Where you want to get it, the knowledge?
From the history and also physical
That
examination.
one if you want to know from the patient.
Yeah.
But the premise for you to solve this problem is that you have to have the knowledge of the causes of shortness of breath in the children. Where you want to get the knowledge, shortness of breath in children?
From the book.
From the book or from your
physical examination.
Hari-hari you pakai apa?
Google.
Handphone.
Google. Google.
You Google hari-hari you Google. Berapa ramai you baca buku sekarang ni?
Tak ramai.
So do you have that knowledge or not? Tell me the causes.
Maybe due to pneumonia.
Lagi?
Bronchiolitis.
Lagi? Dua je. Kos banyak. Fadila?
Acute exacerbation of bronchial asthma.
Lagi?
Bronchiectasis.
Bronchiectasis.
No.
2 hari saja. You talking about 2 days. Najira, I expect you to read about this case you present. So what the causes of shortness of breath in this case? You see, causes shortness of breath pun tak dapat nak cari.
Community acquired pneumonia. Pneumonia.
We talking about pneumonia dah mention dah. Anything else?
Acute bronchiolitis.
Dah mention dah.
Acute exacerbation of asthma.
Dah mention dah. Can you be more, tak payah mention orang lain punya.
Okay, croup, epiglottitis, croup. Epiglottitis, congenital heart disease.
Congenital heart disease, it becomes shortness of breath. What we call that?
Failure symptoms.
Okay, congenital heart failure lagi.
And then pertussis.
Apa?
Sorry.
Empat dia. Aduh. Fazira, Google. Aisha, do you think the child is having a croup?
No, because there is no barking cough.
Lagi?
And then patient already 1 year 1 month, so patient already get the vaccination, I guess.
Mana I guess, this is not such thing I guess. You know, you don't know. Dan doktor ni dia tak guess tau.
Because
you have to definite on your decision in your decision. You play patient life, tak ada guess. Itu saja. Because of no barking cough. Is it the most important?
No stridor, no hoarseness of voice.
Lagi itu je. You think the child got foreign body injection tak?
Basically, if foreign body, it is acute, but this is already 2 days.
Lagi? But it can come later. Second day, they can come with day.
And then there is no cyanosis, no.
You mean that all case foreign body must ada cyanosis?
Any respiratory distress like
come on lah, patient got respiratory distress. Kenapa you nak bunuh diri you sendiri? Argument on that. Patient got respiratory distress already. Why? Why you think it is not foreign body? Okay, probably you say 2 days. Okay, okay, but then not to say we have not seen foreign body came 2 days later. We have seen. Sarah, you think this patient got heart failure or not?
No.
Why you think no heart failure?
Because although she had shortness of breath, we need to find other causes, other symptoms of heart
Apa simptom dia?
failure.
Jawab macam doktor. Okay, nak mention your symptom. Apa you punya argument tu?
Peripheral edema. Peripheral edema.
Peripheral edema 1 year plus. Okay lah. Some of them have, some of them don't have. Lagi? Satu je.
In physical examination,
we don't talk of physical examination yet. We're talking about history, because history can solve 70% of the problem in children. Tak tahu symptom of heart failure. Apa lagi symptom of heart failure? You need to elicit from history.
Lethargy.
Okay, the patient got lethargy. Okay. Nurul, nak tolong tak?
Okay, so
You
for
want to help? You don't want to help?
Yes, I want to help. So for the history, usually the patient will usually come with the history of poor growth.
Lagi?
And then poor in feeding.
Lagi?
Patient with heart disease also have a certain syndrome such as Down syndrome.
Okay, lagi?
And then they also can come with the
letihnya lah. Ada letih lah ini. Menunggu. Decrease effort tolerance, otopnya, chronic cough. Letih ada tarik dah. Fadzil, what the cause?
Sorry, Doctor.
Shortness of breath. List try Google dah.
It can be pneumothorax.
Lagi?
Can be viral induced wheeze.
Lagi?
Can be for pleural effusion, diabetic ketoacidosis, pulmonary embolism, epiglottitis, laryngospasm.
Lagi apa lagi?
Atelectasis.
Atelectasis. Okay lah, dia warna pneumonia lah mainly lagi. Itu je dapat Google. First time Google ke okay Google dah? Then you see you all can that's sad thing about you all. You all doesn't know how to Google. Because you don't use so much how to Google. You don't know because there are many websites. The Google dia ada teknik juga. If you want to find which one, if you familiar how to Google, you just know how to get it. You thought that kalau Google ni you dapat immediately. The skill that you have to learn also. You want to make your life easy. How you to get it? You kena selalu Google. That you know how to shortcut your Google. How to get your info that you want. Which one yang info yang appropriate. Dia banyak website yang tak betul. If not, you read the book. It takes you more time. Tapi you use both. Rugilah if you don't know how to Google. I don't know, mungkin one day bila exam besok MCQ kita pernah Google kan. Ya. You think we should allow you to Google during the MCQ or not? What you all think? Because real life are like that. Real life is everything you want to Google, right? Yeah? You think we should allow you all Google for MCQ or not? Yeah? What you all think? We move forward. But you mean that it's not going to be easy question anymore lah. Cuba you Google URTI cause shortness of breath. Berapa website kata true, berapa website kata tak true. Not, it is not true. You practice, nanti you found out how confusing Google is if you doesn't know how to use properly. Okay, you see the approach, two cases are different. One is a chronic case, another one is the acute case. See the chronic case, you give to me diagnosis acute suspension vocal asthma, but still fail. Because I can tell you, the mom can tell you, the mom will beritahu pada dia, anak saya kena lelah. So diagnosis is not very significant. It's how you approach the case. The second case, yes, the diagnosis are important. You do not get diagnosis, you fail. How you argue on the diagnosis. The second case is not the argue of diagnosis. The first case is argue about what the disease is all about in these children, in this child. Because it's a chronic case, asthma. Okay, any questions? Ada letih dah. Dah tunggu you bagi jawapan tu susah lagi. Any questions? Tak ada. Okay, finish.
Thank you, Doctor.
Thank you, Doctor.
Thank you, Dato.
Thank you, Doctor.
Good.
Thank you, kawan-kawan. Thank you, Mas. Power lah. Mas Ha.
Benda tu.
Record dah. Bye-bye.
Buang lah.